Yeah, after the president signs this bill into law on Tuesday, there are some shorter-term aspects of this reform that will go into effect sometime this year, including one that will allow community health centers like the Miramont Family Center here in Fort Collins to nearly double their patient load. The Senate bill includes $5 billion in immediate support to provide temporary coverage to uninsured Americans with pre-existing conditions. The money would help folks until the new health care exchanges in the Senate bill are put into effect in 2014. Dr. Juan Rodriguez with Miramont Family Medicine says that will have a major impact.
We see some of these patients come and they just can't get their insurance because they maybe have a history of a type of cancer. It might be even in remission, but they just have that condition, and because of that they cannot get the health insurance, or if they do get it, it's extremely expensive.
Other changes include children no longer being excluded for insurance based on pre-existing conditions. Children will also be able to stay on their parents' insurance until age 26, and seniors will receive a $250 rebate on prescription drug coverage under Medicare Part D. Dr. Rodriguez says he thinks it will be a little chaotic at first.
Well, my first thoughts is going to be a little bit of a chaos at this time because everything's changing. But in the long run, I think it's going to be really good for a lot of patients that do not have health care, and we see that a lot here.
The plan is that most of these provisions will take effect this year, and some as soon as 6 months after the law is enacted. Now, one of the bigger questions was where are all the doctors going to come from to help these new nearly 32 million people who are going to be insured now? The healthcare reform bill now provides investment and training programs to provide more primary care doctors, nurses, and other public health professionals. Reporting in Fort Collins, Tom Livingston, Northern Colorado 5.